Okay, Unit 7, Personal Care. This is Chapter 12 in your textbook. AM care refers to what you would do when you get up in the morning. So think about all the things that you do when you get up in the morning to get ready to go to school or work. You wash your hands, wash your face, go to the bathroom, brush your teeth, eat breakfast, get dressed, brush your hair. All of those kinds of things are included in that AM care. They're activities of daily living. PM care, this is things that you do before you go to bed. So before you go to bed at night, you're probably going to use the bathroom, brush your teeth, wash your face, put your pajamas on, all of those kinds of things. So that's all included with PM care. A couple of vocabulary words would be good to know. Hygiene is talking about methods of keeping the body clean, while as grooming refers more to the practice of caring for oneself. So like the fingernails and the hair and making yourself look nice. Oral hygiene. Oral hygiene consists of not just brushing the teeth, but cleaning that whole oral cavity. So it's brushing the teeth, the gums, and the tongue. Flossing, caring for the lips, caring for dentures, all of that's included under that oral hygiene category. Remember, when you're performing oral hygiene, you want to wear gloves because you are coming into contact with mucous membranes, and that's always an area of risk. This is giving a picture or an example of what it looks like when you're helping somebody to perform oral hygiene if they're not able to get up and go to the sink. Denture care, if you're caring for dentures, there's a couple of factors that are really important, okay? First of all, dentures are very expensive. So you want to make sure that when you are cleaning dentures that you use great amount of care, that you place a washcloth or towel of some kind in the bottom of the basin or the sink so that if you would drop it, it wouldn't break. And that you are making sure that you're putting them in the proper cup, labeled cups, etc. So we are wearing gloves once again when we're cleaning dentures. Lukewarm water, covered cup, cool water could work also. Let's see, when you're brushing dentures, make sure that you're careful with them. That was the main thing I wanted to specify, and there's a picture of what that might look like. You can see the towel in the basin and they're brushing those dentures. If you are providing oral care for an unconscious resident, and there is a video about this that you can watch, you need to make sure that this is done frequently and that they're laying on their side when you are cleaning their mouth. We are trying to remove the spores or prevent them from developing and keeping that mouth clean and moist. We want to use as little liquid as possible so that they don't aspirate or have liquid go into their lungs. That would be what we're trying to prevent. And remember, when you are working with an unconscious resident, they can still hear you. So explain what you're doing. Don't just jab stuff into their mouth. Tell them, I'm going to put these swabs in your mouth now. We're going to clean your tongue. It might tickle, that kind of stuff, because they can't hear what you're saying. So for the following residents, oral care is very important. If they are unresponsive, okay, they're definitely going to need some help there. If they have a nasogastric tube, that's also really important because their mouth is going to be drying out and needing some extra attention. Oxygen can also dry out a person's mouth. And if they are in, which means nothing per os, meaning they can't have any food or fluid. So we definitely want to be providing them with oral care in this situation. This is a picture of providing oral care for the unresponsive patient. Once again, you're going to watch a video on that, but it's showing the tongue depressor covered in the gauze is helping to open the mouth up where you can use the swab to go in and clean the mouth. They are laying on their side. They have a towel there. We're using as little liquid as possible. All right, so let's move on to shaving. Shaving is another form of personal care that you'll be providing. When we are shaving, we do definitely want to use gloves because there's a chance you could come into contact with body fluids, meaning blood, when you're shaving. Hopefully you won't cut them, but that can happen. You're always going to soften the beard first if you're using a disposable or a safety razor. Now, if you're using an electric razor, we don't need to do this step. We can just go straight to cutting their hair with the electric razor. But with a safety razor, we're going to soften the whiskers. We're going to get a nice hot towel and hold it to their face for a few minutes to soften that up. Shave in the direction of hair growth. So like ladies, when you're shaving your legs, you're going against hair growth. You're going up the leg. But when you're shaving a man's face, you're wanting to go with the direction of hair growth. So that'll typically be in a downward or kind of to a side motion. Use aftershave if desired, and we don't trim the facial hair. We're just doing like shaving. We're going to discard disposable shaving products in not the trash can, but the sharps container. And we don't share razors between residents. And if you are wanting to use an electric razor, make sure you check and see if it's safe to do so. Don't use that around water or oxygen because that could provide a spark. This is an example of shaving a man with a disposable razor. You can see he has his right hand up on his head and he's holding the skin taut, which is really important. He's holding that skin tight and then he's shaving down in the direction of hair growth. This is going to be an important factor that I'll be watching for when I'm doing your evaluation videos. Are you holding the skin taut? Nail care, we've checked off on this skill, but I just wanted to go over a couple of factors. Do not cut the resident's toenails. They have a podiatrist that comes in and does that. There's a lot of elderly people who have loss of feeling, especially if they're diabetic, to their feet. And so an injury like an ingrown toenail or something like that could cause loss of that foot because they can't feel it. So we don't want to cut toenails. We're not supposed to share nail equipment with more than one resident, and nail care should be done every time you bathe a patient. You should be looking at their nails, okay? So sometimes we think about nail care as, oh, we're painting their nails and we're massaging their hands or whatever, but every time you wash their hands, every time you are giving them a bath or a shower, you should be addressing their nails. Do their nails need to be cleaned? Do they need to be trimmed? Are they smooth? Are they clean and smooth? That's your goal. So anyway, this is just an example. You're giving a bed bath. You can have them soaking their fingers or their hand in the water while you're bathing them. That's one example. All right, so you've already checked off on that skill. Hair care is next. When you're styling a person's hair, don't do childish hairstyles. Try to let them choose how they'd like their hair done. And we don't cut their hair. There is a beauty shop in most facilities, or their loved ones can take them out somewhere to have their hair done. Let's see. Okay, let's talk about some bed pans. This is called a fracture pan. And so this part, the narrow part is what goes under the buttocks. The handle goes toward the end of the bed. You always have the handle facing the end of the bed with a fracture pan when you're putting that under somebody. It's easier to get under their hips. It's more comfortable. You're going to see a lot more fracture pans than you will see of the standard bed pans. The standard bedpan, the wider part goes under the buttocks, and then that higher part goes up toward the front. Portable commode. This is a chair that can be has a removable bucket that they can go in the bucket and you go and empty it. It's sometimes called a bedside commode. This is good for a person who can get out of bed but maybe can't walk to the bathroom. So you can sit it next to their bed so they're still getting up and sitting in a more natural seated position to have a bowel movement or to urinate, which is good for them to get up and move, but maybe they can't get all the way to the bathroom. Bed pans would be if they are not able to get out of bed. This shows you also how a bedside commode could be placed over a toilet and it can act as an elevated toilet seat. which can be very helpful for someone who has knee or hip issues where they're not able to bend down quite as much to sit on a low toilet seat. Make sure you check your book 279 to 280 for information about bedpan placement. There's some good info in there. Make sure you know the difference between a standard and a fracture bedpan. There is some videos that you can watch in the video section on bedpans and techniques and toileting, so make sure you take a look at that.